The bright lights and thrum of humanity in New York City feel a far cry from the somber bleakness of a cancer diagnosis. But I'm here to learn more about this fatal set of diseases which are increasingly claiming the lives of younger and younger people. Globally, between 1990 and 2019, early onset cancer, that's cancer in people aged under 50, grew by around 79% according to a recent study. And that trend shows no sign of letting up. I'm here on the US East Coast to meet some of the people affected by this and to find out about the scientific breakthroughs which are helping them to fight what was once considered a disease of the old.
Yeah.
31-year-old Kelly Spill Benito never dared to dream she might have this healthy family of 4. She was diagnosed with cancer just months after giving birth to her son, Jace.
I was told that I had stage 3 colorectal cancer, 28 years old, and I was then told that I most likely will never be able to carry a baby again. My first thought was, how long do I have to live? That's kind of what you connect with cancer, I feel like, is death. And then I looked at my son and I thought, I need to be here for you. He was 8 months old at the time.
But then she was offered a clinical trial for a drug which could activate her immune system to fight the cancer without the need for surgery, chemotherapy or radiation.
By my 9th treatment, I was told that it had completely disappeared.
And a year ago, against all the odds, baby Maya was born.
I didn't want to let her go, like ever. I could cry right now just thinking about it. And it didn't only change like my life, it impacted my husband's life, but my son, he said to me yesterday, remember when baby Maya was born and I held her in my arms? I'm like, yeah, I do. I can't believe you remember that. And so going on this clinical trial, I mean, it's completely changed all of our lives.
But in the US, none of this comes cheap. Cancer patients pay $16 billion out of pocket annually for cancer treatment, according to the American Medical Association. As a clinical trial participant, Kelly was lucky that her costs were covered by the charity funding the research, Stand Up to Cancer. She was treated at Memorial Sloan Kettering Cancer Center in New York, the first hospital in the US to open a center specifically for young-onset colorectal cancer patients.
The biggest increase has really been in the youngest group, the 20 to 29 group. A lot of them, are either wanting to start a family or had just started a family. Many of them don't have wills and all of these things that, most people in their 20s and 30s aren't thinking about. The majority of these patients don't have a family history or genetic component. So the second part was really to try to figure out why this is happening.
To that end, they take detailed information from every patient.
We're asking about risk factors, exposures, diet changes, antibiotic use, other things that we were thinking about that have changed throughout this time, C-section rates, breastfeeding rates, age of parents at time of birth of children, which has changed throughout this time period. So these are things that we're definitely looking into. We've been looking at their stool for microbiome changes. I think in the end, it's probably not going to be one thing, because I think we would have figured it out by now. And it's probably a combination of factors together.
So for now, patients like 43-year-old Jeff Harris don't know what caused their colorectal cancer. He struggled to believe his diagnosis 3 years ago.
My wife's holding my hand, squeezing in. I'm like, what? I'm just like, what? What is happening?
How on earth do you tell your children something like this?
It was hard because I think my older son had asked me, is it possible you could pass? And I was like, it's possible, but that's not the plan.
He said that he got cancer, and I immediately started crying. I remember how happy I was when he came back home after his surgery.
But an increasing number of young people don't make it. Early onset cancer deaths increased by 27.7%, between 1990 and 2019, according to a recent study published in the BMJ Oncology.
The Sidney Kimmel Cancer Center.
At Johns Hopkins Sibley Memorial Hospital in Washington, D.C., the number of cancer patients rises each year.
Yeah, so we see every type of cancer there is.
Director of Medical Oncology, Dr. Ben Levy, specializes in lung cancer, the most deadly cancer in the U.S.
The percentage of patients that we're seeing with multiple malignancies is growing.
Doctors here see 150 to 200 patients every day.
Facilities like this one are just getting busier and busier as the number of cancer cases increases. There were 20 million cases diagnosed worldwide in 2022, and the World Health Organization says that number could rise by 77% to 35 million by the year 2050.
But Dr. Levy believes there will also be far more advanced detection and treatment by then.
My guess is in the next 5 to 10 years, maybe 10, you will be able to go to your primary care physician and they could do a blood test that's reliable to tell you, if you have cancer that hasn't been seen or what your risk of cancer is in the next 5 to 10 years. You couple that with something like artificial intelligence, where you're able to do a blood test or even a scan, adding in the layers of artificial intelligence, and maybe it becomes more accurate.
Funding is vital for that kind of research, according to the CEO of the Colorectal Cancer Alliance, which has just launched a multi-million-dollar research program.
It's the largest philanthropic investment that has ever happened for our disease. I mean, you think about even immunotherapy now and what it's able to do for a very small subset of colorectal cancer patients. Can we turn that immunotherapy and be able to unlock the other 95% of patients that right now that have colorectal cancer can't respond to it?
I think it likes you.
For Kelly, that therapy not only saved her life, but gave her a future.
Where'd it go? Oh, there it is.
Giving her time to enjoy her longed-for family and to make plans to expand it further.
Gia is the eldest of 3 children. A year ago, she lost her right eye to retinoblastoma, a cancer of the retina cells. At just 12, her vision was impaired. A few years after, her younger brother lost both his eyes to the disease. Now, it's her youngest brother, just over a year old, who's been diagnosed with the same cancer. Her mother recounts the toll it's taken on their family.
पहले तो अपना गाड़ी था, जमीन था, बेच दिए सब। बेच कर सब दोनों में लगा दिया, दुकान सब। फिर ये हुआ तो अभी ये बीमार पड़ गया, तो इसके पापा 3.5 लाख लोन लिए हैं, उसको भर रहे हैं वहाँ पर गांव पर। इसको इलाज हम करा रहे हैं।
This shelter, run by an NGO, Can Kids, Kids Can, houses dozens of cancer-stricken families like Gia's. 5-year-old Zainul is among the survivors. Her leukemia is in remission after rounds of chemotherapy that her mother describes as the most harrowing experience of her life.
ये बहुत दिनों तक तो हंसी भी नहीं, बोली भी नहीं, एक ऐसा लगता था एक मूर्ति बन गई हो। तब बहुत दर्द होता था, लेकिन जब भी अब हंसती है, खेलती है, बोलती है तो बहुत अच्छा लगता है।
Their joy hides layers of pain underneath.
सबको उम्मीद थी कि बेटा होगा, वो जब पैदा ही हुई थी तभी किसी को पसंद नहीं थी, जब इतनी बड़ी बीमारी से लड़ी तब कैसे कोई साथ दी।
Social exclusion and financial ruin are among the many challenges Indian families battling cancer can face. According to government data, India recorded about 1.4 million new cancer cases in 2022. That number could rise to about 1.6 million by next year. Experts warn there could be just as many undetected cases. An estimated 4% of all cancer patients are children. And while experts say younger patients are more resilient and responsive to treatment, India's stretched medical infrastructure widens the gap between those who survive and those who don't.
In the developed countries, 80% children survive, right? Survival rates are at 80%. In low middle income countries like India, survival rates are around 20 to 30%. A big part of that reason is that children are not being able to access care. So if they don't access care, then they will not survive. On an average in India, we believe that survival rate is about 50 to 55% when children reach a cancer center.
As India's cancer wards continue to overflow, the government has announced a number of new measures. They include a new national screening programs focused on the most common cancers such as cervical and breast cancer.
We have sent one sample to AIMS also.
Several funds, including a federal health insurance scheme, a financial assistance program tailored to the poorest, and a cancer fund have also been set up. The government says facilities have been upgraded at dozens of government-run hospitals to tackle childhood cancer specifically. We're in a government-run hospital where the cost of care, medication, diagnostics is all taken care by the state. But all of these costs can rack up pretty quickly to thousands of dollars in private hospitals. And that's where the role of civil society groups comes in. With overwhelming demand for government facilities and limited availability, joint efforts are necessary.
So we have extensively mapped states to see where are these hospitals, what do we need to do to help and work with the government or the private sector to strengthen the hospital network.
Just a 2-hour drive from New Delhi is Ganganoli, a village that has none of these facilities or support systems, but which desperately needs them. Vipin Rathi tells me a third of the villages here are affected by cancer. There's no official data to confirm this, but all the locals we spoke to had the same estimate. Media reports have dubbed this place India's cancer village. Vipin, like many others here, was diagnosed with a malignant tumor in his stomach. Doctors told him it's possibly due to the water he's consuming. The Krishna River, the lifeline of some 6,000 households in this village, is severely polluted with industrial waste from nearby sugar and paper mills, turning the village's residents into social pariahs.
गांव में कोई रिश्ता लेकर नहीं आ रहा हमारे यहाँ। उनका कहना है कि हम आगे अपनी लड़की मार नहीं ले आंधी के।
Some children have also been born with bone deformities, which locals blame on the water. Their families say though they haven't been diagnosed with cancer yet, the spectre of the disease looms large. Cancer cases aren't limited just to this village. In fact, a number of villages in this region have reported rising rates of cancer in the past few years. And what do all of these villages have in common? All of their inhabitants use water from this river and its tributaries. A ruling Bharatiya Janata Party leader told the Indian Parliament last year that this water is a source of cancer for 100 villages in this area. It highlights how environmental factors might lead to cancer in a country where 2/3 of the population live in villages with minimal healthcare services. India's National Green Tribunal has ordered multiple investigations into the polluters, and despite some action, locals say not much has changed. Doctors say India's rising cancer cases are also a byproduct of rising population and longevity. Rapid industrialization and changing diets and lifestyles also play a part.
We are matching the Western world in terms of hypertension, diabetes, and now cancer as well. So overall, the burden, disease burden that we have of the two groups of diseases together is really going to be a major challenge in the next few years.
India's huge pharmaceutical industry produces cheaper cancer drugs than most major economies, but cheaper may not always mean better.
The drug control authorities and a lot of regulatory agencies, the CDSCO, they are now focusing a lot, not just in quick licensing, but in doing much more quality checks.
The government also has recently removed tariffs on 3 crucial imported cancer medicines to make care more affordable. With proper care, 8 in 10 children can beat cancer. This school in Mumbai, run by Can Kids, Kids Can, teaches survivors to prepare for the future, instilling the belief that they are not victims but victors over cancer.
In the eyes of those who've lived 9 or even 10 decades, perhaps a hint, a clue to the secret to longevity. Like many before us, we've come to Seulo on the Italian island of Sardinia to find out more about the town's centenari or centenarians, people who live to 100 or older. After initial research 20 years ago found a high prevalence of validated centenarians, this area was eventually named one of the world's 5 blue zones. The others are in Japan, Costa Rica, Greece, and the US state of California.
Questo riguarda questo.
Seulo's mayor, Enrico Murgia, is showing me the town's birth and death records, which go back to 1866.
La prima cosa da dire è che per dire noi siamo una comunità longeva, la prima cosa sono i dati. Tu devi avere i dati, non tanto scientifici perché non c'è scienza, ma dati, come dire, anagrafici. Quindi 2 date sono importanti, la nascita e la morte delle persone.
Here's one incredible stat from the records. Of all the babies born in Seulo in 1922, about 43% made it to at least 90.
Se capiterà.
And then the mayor opens up the records from 1923.
Carta Luigi.
And he finds the 25th baby born that year, Luigi Carta. He's now 101 years old. Most mornings you'll find him sitting and chatting by the side of the road. He doesn't like cameras much, but after a little persuasion, he let me ask him what the secret is to living such a long life. Only God knows, he says. A relative spring chicken at 93, Antonello Lai believes it's all about lifestyle.
Si lavorava in campagna, si mangiava tutta roba genuina. Carne se ne mangiava poco.
E vino è importante?
Il vino è importantissimo.
The nearest hospital to Seulo is about an hour's drive away, but researchers also note that several of the blue zones are quiet, tight-knit communities in mountainous areas with many farmers. This town is perched up in the mountains in the centre of Sardinia, and really all of the streets are similar to this, just up and down and up and down. Now, I'm about 60 years younger than some of the local residents, but I can tell you, this is still pretty steep.
Una chiesa vecchia.
Another 93-year-old, Fausto Murgia, has spent the morning working in his kitchen garden.
Forse è l'aria e anche l'acqua, perché l'acqua, invece di comprarla, andiamo alla sorgente e la prendiamo lì. Acqua naturale che scende per la montagna.
E forse la dieta tradizionale come è?
Guarda che io mangio di tutto quello che trovo.
A very different approach to today's highly regimented diets and exercise routines. So we're leaving Seulo now and we're driving down to the coast, and we're going to investigate how the traditional diet in blue zones like this one is actually having an impact on the fight against different types of cancer. Maria Carta grew up in Seulo and now runs a restaurant in Cagliari, the regional capital of Sardinia. I don't know it yet, but she's preparing some minestrone for me, a vegetable soup with a little prosciutto ham. It's a typical dish in Seulo, the opposite of ultra-processed foods, high in sugar, salt and saturated fats that dominate diets in many parts of the world.
Il minestrone era il piatto che potevano avere tutti in casa, cioè non si mangiava tutti i giorni carne. A Seulo la dieta tradizionale è sicuramente fatta sì di molte verdure, di molte zuppe, di latte, di carne e formaggi.
But while people in Seulo have been eating this kind of food for hundreds of years, research into how it might prevent cancer is still in its early stages. On the Italian mainland, scientists are conducting a vast experiment known as the Molisani study. About 25,000 people living in the southern region of Molise are taking part, with their biological samples carefully stored in liquid nitrogen.
Per cui lo sforzo di ricerca che abbiamo fatto unitamente alla Fondazione Umberto Veronesi è proprio quello di capire, utilizzando dati di una popolazione italiana, diciamo, i fattori di rischio alimentari principalmente per una popolazione italiana. Questo è particolarmente importante perché la maggior parte degli studi e quindi anche delle linee guida che noi adottiamo vengono però da studi condotti per esempio in paesi come gli Stati Uniti, UK.
According to their research, the typical Mediterranean diet, with its emphasis on fruits and vegetables and whole grains, can help people recovering from different types of cancer.
E in questo senso abbiamo visto che le persone che anche dopo una diagnosi di tumore continuavano o riportavano un'aderenza buona alla dieta mediterranea, negli anni avevano un'importante riduzione del rischio di morire non solo per tutte le cause ma anche in maniera diciamo più specifica proprio di tumore.
Blue Zones were the subject of a landmark Netflix documentary series released last year. It's just one sign of how the scientific concept has mushroomed into a trend, with websites offering tips on things like the Blue Zone diet. So while it can be hard to tell where the science ends and the marketing begins, the link between the Mediterranean diet and lower cancer rates has been demonstrated in many studies over the years. And it's clear that the residents of Seulo have a relationship with food and time that's profoundly different to people who live in big cities.